Why the United States should have universal health care. What is universal health care? Universal health care is a system that provides all citizens with basic health services. What is the problem with the United States not having universal health care? Citizens of lower classes are subject to minimal or no health care, and the U.S. is spending large amounts on health care but not getting a lot out of it. The image in the top right corner shows every country that has universal health care. Out of the most developed countries, the United States isn't one of them. And countries that aren't even more developed countries have universal health care. Main reasons: citizens could all get medical help, the United States would be healthier, and it would boost the economy. Available and affordable for all? Every year, 100 million people are pushed into poverty, and 150 million people suffer financial catastrophe because of out-of-pocket expenditure on health services, says the World Health Organization. Almost everyone knows someone who refuses to see a doctor when they are sick due to the fear of outrageous doctor's bills that will be waiting for them in the coming days. This is a major flaw in our system. People should be able to afford treatment for a little cold. Now imagine those who have to pay for something worse than a cold. That could leave them homeless on the streets. Universal health care also goes into the community to fix things. They add supplements to water and control pest population and an active prevention of things that can negatively affect someone's health. Overall health improved? Britain spends less than half of what the US does on health, but its citizens are still healthier than the United States is. Quality care will not disappear, but improve. This can be supported by one study that found that those with national health programs have produced some of the leading physicians and hospitals in the world. An economy boost. Several international studies have estimated an increase in labor productivity between 20 and 45% in the medium to long term. Increased life expectancy resulting from universal health care could raise a country's GDP by 4%. And in this image, we have Canada and the United States. Canada, blue, and the United States, this greenish color. Per capita spending, Canada spent $3,000, but the United States spent $6,000, and Canada has a universal healthcare system. Counterclaim. The United States government should not play such a large role in society. And universal healthcare systems give out free laziness passes. People should have to work for what they get. Response? The government would play a large role, but only to guarantee the health and safety of United States citizens. Universal healthcare supports a lot of the elderly, so should they work up to their death to get decent healthcare? No. And in this image, we have the causes of death in the United States in 2009. At the very bottom, on the very end, is terrorism, then salmonella, swine flu, firearms, unintentional falls, traffic-related, and then, causing the most deaths, 45,000, lack of insurance. In conclusion, the U.S. should have universal health care because citizens could get medical help, the country would be healthier, and it would stimulate the economy. WHO puts it simply as, all countries can do more to improve health outcomes and tackle poverty by increasing coverage of health services.